for joining. Thanks to everyone that has joined. So we are going to kick off immediately. Um, can you all hear me?
Yes.
Okay, good evening, everyone. For those that have joined and for those that will join, you're welcome to this edition of Traveling Beyond the Label event. The focus is demystifying speech delay in children, and we have two wonderful guests for us waiting already, ready for us. So before we go into it, I just always like to give the backstory about our speakers. So first of all, Dr. Lola is going to be giving a presentation about speed delay, and her profile is just wonderful. She's a trained medical doctor. She's an autism professional. She's a behavior analyst, and she's a tech enthusiast, which for me is very interesting because technology is one of the key things that I know can support communication for children with speech delay. She's the visionary founder of Autism Renewed, which is actually something that I joined, a conference that that she did a few months ago, which I joined. And she actually went to the same school as I did, Federal Government Girls College, Shagamu. I did not know this at the time, so I actually knew this afterwards. And I'm so excited to have her share her knowledge. She's very, very vocal on social media, and we are really privileged to have her today. And the other speaker who is going to join in during the Q&A is Mrs. Felicia. If you have read A Champion Speaks, you definitely have heard of this woman, though I did not call her name. She was the one who helped my first child in supported him in gaining speech. She's very, very special to me. And I think it's just wonderful that we have had the opportunity to reconnect for such a time as this. She's based in Nigeria, and Dr. Lola is based in Australia at the moment. So we're getting a very rich event today. So I'm going to stop sharing now so that Dr. Lola can take over. So feel free to start your presentation. And if you have any questions, just keep them until later when we're going to the Q&A session, because I really want us to know the theory behind speech delay. That's why we have such a wonderful professional delivering today. So Dr. Lola, over to you, please.
Okay. Can we see me? Can we hear me? Can you see me? Can you hear me?
Yes.
Yes, we
Can you
can
hear
hear
me?
you. Yes,
Yes, we
we
can
can
hear
Okay,
you.
see.
thank you. Okay, thank you very much. Good evening. It's good morning from here, actually. Whatever part of the world you are joining us today. I want to appreciate the privilege given to me to speak today. I want to appreciate Mrs. Eniola Oyegule. Thank you so much for this period and platform. Thank you, everyone. I'm excited to be here to share. So let me share my slide. And also, I'll be able to cover quite a bit. And there's so many things I had to leave out. If not, I can talk about this topic for 2 hours or 3 hours, I will still be here. So I'll just go quickly so that if you have questions, then that will direct further things that I will talk about. But of course, we can't talk about this even in 2 hours. It's not enough. So if you have questions, please just note them down. I'll take our questions after. So I will try to maximize my time. Okay. So the aim of this class is to equip, I'm sure they've told you about me, so I'm not going to go into all that today, to equip parents with clear understanding of speech and language development, to help us recognize the signs of speech delay, to debunk some common myths, and to provide practical strategies and tools to support and advocate for your child's growth and development. A bit of outline, we'll have a bit of introduction, look at some differences between speech, language, and communication, examine some milestones and red flags, look at some causes of speech delay. Of course, there's so many causes. We can't exhaust all the causes, but just like a broad overview, then what parents can do at home, when and how to seek help, and we conclude. So as a way of introduction, many parents often ask me questions like, is this just a phase, or should I be worried? My child is not speaking or catching up to their peers, or this my son compared to my first child is different. Is this just a phase? Will it pass? Should I be worried? Today, we're going to demystify these questions. We're going to ease your fears and empower you with tools to take confident steps. So the first thing I always like to talk about is the differences between speech, language, and communication. Even though we say speech delay, to be honest, speech delay is not often the correct term. But sometimes as professionals, we use terms that parents can or the public can easily relate with. So over time, speech delay has become like the relatable word or the term that we have used to coin a lot of language, communication, and speech issues. We put them all under speech delay. But to be honest, what most children often have that is called speech delay is not really a speech delay, it's often a language delay, and sometimes even just communication issues. Because really, when it comes to speech is just the act of producing sounds when it comes to things like articulation, things like your voice, your fluency. It's just like I'm sure most of us have seen someone that has a stroke, and when they are recovering from the stroke, you can see how their speech is often slurred. They can't really articulate properly. But you know that it's not that they lost their language, and most of them don't even lose their comprehension, but their ability to articulate what they want to say is what the issue is. So that's what you call a speech delay. Or I mean, if a child is experiencing that kind of articulation, that's what you call it, really a speech delay. Or sometimes even things like you see some children, they can articulate well. Sometimes we even have all these R or maybe all these sound issues. That's what speech issue is. That is not really language, which is not what most children have. I mean, the speech thing. It is more of language or communication. So language is when you pick words together, sentences, you now use it to, mean something. When it comes to language, because we're talking about speech delay. So for the purpose of, just generalization, we will say speech delay. But I'm trying to help us understand, because it's in understanding the differences that's how you are able to really support a child. I often say this: you can't help a child from the point of diagnosis. Let me say that again. You cannot help a child from diagnosis. So you can't say, my child is diagnosed with this, then this is now the intervention. No. Even when it comes to speech therapy is not speech therapy. So that's where a child will come for assessment. The speech therapist will do an assessment and isolate the areas, their issues, then provide intervention appropriately. So that's why it's important to understand this concept, so you're able to effectively support your child, even as a parent. So language is now composed of, you have expressive and receptive. So receptive is the ability to take it in and understand. So you hear parents who say, my child does not really understand when I give instructions. While you hear some parents say, my child really understands, but they cannot just express. So language has two components majorly. Even though when it really comes to, when we talk about the cycle of speech development, when it comes to even language, is beyond receptive and expressive. I would say it's three, even though we generalize and say two. Receptive is taking it in. But after taking it in, the child must be able to process. So you notice some children, they have more of processing issue, which is what is delaying the expression. So because there's also what we call, sensory processing disorder. So when I talk about the causes of speech delay, you will see that sometimes there are a lot of associated things that are causing the speech delay. Why this is important is, remember, you can't help a child from diagnosis. If there's a processing issue, part of the therapy or intervention would entail things that are going to help to speed up processing of the child, to aid expression. So you notice some children, when you say something, they will take it in. It takes them time. And sometimes some parents get upset. You feel like the child is ignoring you or the child is not. And some children are actually having a processing issue. So it's taking them time to process what you're saying, then to be able to give a response. Then we now have the expressive. So when it comes to language, you have to be able to understand those components to effectively support a child. Then communication, the process of conveying a message or meaning to establish a shared understanding. So of course, we all know communication is beyond words. This is very important when we're talking about intervention, because most parents focus on just language or just words, not knowing that the most important thing is not just communication now, functional communication. When I start talking about some other things that I'll go more into this. So communication is beyond words. So a child may even have limited language or speech issues, but can still communicate using other means. Okay. So of course, I used a bit of, I saw some of these charts, and for me, they explain some of this concept properly. Here, I talk about speech, how we articulate sounds and words to express our thoughts. So under speech, the voice, the quality of the voice, the pitch or tone. So you notice that some of our children, they sound very robotic sometimes. So those are some of the things that the speech therapists will always work on during therapy, even as they are helping the child build language. They will help the child with articulation of speech, tonation. Because you know when we talk normally, you talk normally high, low, but some children, it's like they just talk very flat or very robotic, or like all these cartoon characters. So those are some of the things that the speech therapists will work on when they are helping the child with their language development. So, of course, language, how we use words, expressive, receptive, and pragmatic. So, pragmatic has more to do with the social use of language. So, some children may even have language, but they may not have not in a pragmatic way. They just have words or sentences that they can say. But we know that when you are in an environment and you communicate, there's a social use of language. That means that there's an appropriate way, appropriate tone, and also being able to read other people's expressions in order to know how to communicate or use language appropriately. So some children may have words, but they may not have social pragmatic use of language. And that's also very important to note. So this also explains it, communication, social use of language, how we talk, how we interact with other people, very important. I think I've explained that. So the ultimate goal should always be functional communication. And I say this because I have a lot of clients who will come to me and say, but my child can sing. My child knows all the letters of the alphabet. My child can recite nursery rhymes and sing all the songs we sing in church or they sing in school. But my child is not talking. And I explain to them that a child can sing, that a child can recite nursery rhymes, that a child can read 1 to 100, does not depict advancement in language development. So what shows you the level of a child when it comes to language is the ability to communicate and use the language they have in a functional way. How do I mean? A child can sing a rhyme and say, Johnny put the a red ball in the blue basket. Johnny did. He can sing all that. If you give the child the red ball and the basket, can the child carry out the instruction in the song they are singing? If the child cannot, that means the child cannot use the language they have functionally. That is to tell you that child is just cramming. So most children just cram. So if your child can sing, they can rhyme, they are just cramming. It's just taking it. Remember I talked about language. Receptive, you take it in. You process it, then you express. So most of those children, they can take in, but the processing, which is where the comprehension, the understanding to now express it appropriately, they don't even have it. So functional communication is you're able to use the language that you have to be able to communicate and interact with your environment, both physical environment, people in the environment, and things in the environment in a functional way. So meanwhile, I have some other clients that children may not be able to sing, may not be able to rhyme, that children may have just single words, but they can use those words in a functional way. That child is more advanced than a child that can read 1 to 100, can say all the colors, can say all the nursery rhyme, but cannot use it functionally. So this is very important because sometimes parents focus on the things that are not important. We come from a culture, or I would say even a generation where, oh, my child can read 1 to 100, my child can say all the colors. We prioritize that. But it's not as important as some other functional and social use of language. Okay, a child can read 1 to 100. How does that benefit them in communicating every day? A child can say all the colors. How does that help them to functionally interact with their environment? So even when you put your children in school, they develop an IEP and all those things. Your IEP should not just focus on academics, should focus on skills, should focus on tools that the child can use to interact with their world. That's where functional communication comes in. So that's why when parents think that putting your child in front of a screen, oh, well, my child is learning from the screen. Your child is not learning. Your child is cramming from the screen most of the time. Oh, but the child can now sing all the songs that are there. Most of the time, it's just cramming. Most important thing is, I'll talk about the issue of screen later, functional communication. Let's look at some speech milestones. However, note that even though, standard, we have standard milestones, children develop, differently. Most of these milestones sometimes will overlap. That's the truth. Sometimes we overlap, and sometimes we have what we call catch-up growth sometimes. Some children, so that your child is not doing something at 6 weeks. Oh, my child is not 6 weeks. Oh, the child is not doing it. Oh, that means there's something. They may not be something, but it's always a sign. Okay. Also, beyond the exact age of those milestones, it's important to understand the progression. So even if your child has not attained a milestone at a particular age, you are not just looking at the milestone for that age. You are looking at the previous milestones they should have achieved. Because if a child has not attained a milestone, regardless of the age, we usually will trace it according to the milestone. I'll give you an example. If you have a 10-year-old that cannot walk, you're not just going to start from walking, because prerequisite to walking includes neck control, ability for your back to be straight, ability to stand, then you start, crawl, stand, walk, like that. So if a 10-year-old does not have neck control, we're going to start from that. The same thing with language. So we're not just going to say because the child is 2, the child should be doing this by now. No, we're going to trace where he's coming from, because developmentally, another thing I want to mention, developmental age and chronological age, they are different. Chronological age is the age by birth. You were born on so day, so year. But developmental age has to do with the ability and the things they can do, or the milestones that should be achieved by age. So your child can be 5 chronologically, developmental, but developmental also, because we have different milestones. So today we're talking about speech and language. That's just one milestone. We have different milestones. We have emotional behavior and behavioral. We have cognition. We have motor, which is fine motor, ability to write, button up shirt, and all those things. We have gross motor, ability to walk and ability to run. So those are different milestones children have. So sometimes your child may not be the same developmental age across all milestones. So that's where assessment comes in. They can isolate where the issues are. So in terms of emotional regulation, behavior, the child may be more advanced than even speech. Meanwhile, you also have some children, speech-wise, they may be 3 developmentally, but behavior and emotional, they may be 1. So that's why sometimes you find your 6-year-old and you're wondering that this child should have outgrown this behavior by now. You are 6, you are 7, you are still doing this. No, because developmentally, the child is still a younger age. So let me say one thing: children don't particularly outgrow things. So when people say, when will my child outgrow this behavior or that? No, I believe that children don't particularly outgrow things. They gain higher skills that help them to navigate the previous milestone or the lower age. How do I mean? A baby cries for everything. You want to eat, cry. You want to poo, cry. But as they grow older and they gain language or ability to communicate their wants and needs, you see that the crying will reduce. The same thing with all milestones, even when it comes to language. When children gain that, and that's where therapy, intervention, all those things come in. You're trying to help the child build those skills they need to be able to communicate in a functional way, to be able to interact in the environment. So if you have your 6-year-old still having maybe behavioral issues and all that, don't just say, oh, the child will outgrow it or things like that. No, look at it developmentally. Where is the child operating? What are the skills that the child is lacking? Yes, some children may have more challenges acquiring these skills. When children have developmental issues, sometimes there may be things, there may be conditions, there may be things that need to be dealt with that is impeding their ability to gain these skills, or they just need more support, more intervention to help them acquire those skills. So of course, speech milestones, it is not just talking. Remember, I talked about communication. It's not just about language or talking. So that's why a baby ability to coo, make noises, babble, respond, to be aware of their environment, be able to look when he hears mommy's voice, be able to make eye contact, be able to begin to recognize their names or recognize people in their environment is part of language development. Because language is not just words, like there's something I always teach about prerequisite skills before language development. That's what we call like learning to learn skills for language development. Things like awareness, things like joint attention. So if I say hello to you now, you respond to me, we talk back. So you see that language or talking or communication is like back and forth. But if I'm not even aware that you are even around me, I don't notice you, how can we even begin communication? So that's why even when children are younger, it's important for parents to begin to notice those things. But sometimes parents may not notice, especially if it's your first child. You just see that child is a happy child, does not cry, just so you may not notice all those little things when the child should have been babbling, cooing, responding to sound, responding, being aware of their environment, responding to gestures. These are all like social cues. You know, I talked about the social pragmatic use of language. Language is not just the words, all those social cues. Some children have words, but that social pragmatic use of language they don't have. And that's also something that needs to be looked into, children to be supported. So things like by 12 months, they can use gestures, they can say mama. By 18 months, they can use several words. 24 months, they know familiar people, use 2 words, understand verb. 36 months, they understand prepositions. 48, they know basic grammar. By 60 months, the child will be able to speak clearly. I love this other chart for milestones as well. Look at this one. It talks about the speech and language, the hearing and the understanding as well. So at 3 months, the child can cook, can smile, they can recognize voices. This is very important. When I'm going to answer the question, when people ask me, when should intervention begin? When should therapy begin? Even though depending on the part of the world that you reside, most parts of the world, they won't even do assessment for a child until like maybe 2 or 2.5, which I don't agree with. I believe that intervention should commence as soon as there's an issue. But what intervention will look like for a 3 months, for a 6 months, for a 2 years is what will be different. But the concept of professional telling a parent, go come back in 6 months, I think is wrong, because you are losing time. So most times mothers have instinct. At 6 months, they just know something is wrong. This child is not as cooing or behaving. That is when intervention. Because what happens most times is that, yes, some children may end up catching up, but instead of just saying they will catch up, why not begin that strategies or what an intervention that can commence as simple as enriching the home environment to make it a language environment for a 6-month-old can make a huge impact for that child. As simple as if the child has been on screen, removing that screen because that may be what is responsible at that young age. Because what happens is that if there's an issue, the issue will not go away. What time only does is time only makes it more visible. Meaning that, as children grow older, the skills they will require is actually more. So sometimes when you say go come back in 6 months, in 6 months' time, the child should have acquired more skills. The skills are not there. Come back in another 6 months. By the time the child is 1, it now becomes really glaring. It doesn't mean that is when the issue started. So a 5-year-old or a 10-year-old that is not potty trained did not become not potty trained at 10, at maybe 2, 3. Some of those issues were there. But sometimes, we waste time and say, okay, we are hoping. No, I believe that no matter how young a child is, once there's an issue, it should be looked into. But of course, however, what intervention or support will look like at a younger age will be different. So I'm not saying that a 6-month-old therapy will be like a 4-year-old therapy. No, but you don't wait, because sometimes if there's an issue, you are only making it worse. Because what the skills a 1-year-old need, or the amount of catch up a 1-year-old would need, is different from a 4-year-old, different from a 6-year-old. So as the child is growing older, the gap will be widening. Also, when the child is younger, if there's an issue, you're more intentional in even trying to check, okay, other milestone areas. Because often, I will answer the question, is it only autism that causes speech delay and other things? No, most of the time, speech delay is really not a diagnosis, so to speak. It's not really a diagnosis like that. Most of the time, they come associated with other conditions. Yes, it may stand alone, but usually there are things that are causing that delay that we are seeing that we need to deal with. Or there are things that are like predisposing factors or that can increase the child's chances of being delayed. So when there's issue, whether it's 6 months, I believe that it should be looked into. Other risk factors should be checked, and intentional support for language development should begin for that child instead of waiting. So this is another one that talks about at 6 months, the child is able to laugh and giggle. They notice sound, music in their environment. They can move their eyes towards a sound. At 12 months, they have 1 to 2 words, vocabulary. They understand simple phrases. They recognize words for maybe the common items, the things that they like. At 2 years, they can use 2-word sentences. They can follow 2-step direction. At 3 years, they can use 3-word sentences. At 4 years, they can understand all these questions, why. Remember, I said that children grow, and sometimes it's not every child that will meet these milestones exactly. But it's important, if a child is not meeting those milestones, for it to be looked into. And also look at it progressively. Okay, the child has met this one, has not met this one, beyond just the exact age. That's very important. So of course, I just summarize these milestones, most of the things I've talked about, so I don't waste time. Some red flags: the child is not babbling at 12 months, no words at 18 months, no phrases at 2 years, unclear speech at 3. Or then I said beyond the speech and the words, there's some other things you look out for: frustration, or tantrums from inability to communicate. Because remember, functional communication is always the goal. So that the child gets frustrated trying to communicate their wants and needs. Is their child aware of their environment? Is the child able to functionally interact with their environment? Some other things that we'll talk about later that could also be red flags associated with speech delay, telling us that speech delay is not just an isolated issue, because the speech delay is with some other conditions. There's some other things that could happen, things like sensory processing, behavioral issues, even things like sleep issues and other things could be showing us that there may be underlying medical conditions that are going on. Okay, so one common concern is people will say, can too much screen or a child being bilingual delay a child's speech? Bilingual means they are speaking more than one language. When it comes to screen, let me explain the concept of screen. Now we have what we call virtual autism or screen autism. Well, to be honest with you, when it comes to the professional world, that's so many people always argue. Most of the time, we don't always agree on the same things. But I agree that speech can affect, I'm sorry, screen can affect a child's speech and language development. And this is the reason why. We need to understand the concept of screen and the concept of language development. The way God designed us to learn and grow is to use our senses to interact with our environment. That's how real learning takes place. So that's why you see babies, they want to smell, they want to tear, they want to taste. They're just trying to use their senses to interact with their environment. But when it comes to screen is unidirectional. So when a child is in front of a screen, a child is just consuming. So that's why you see a lot of children, yes, they can cram all the songs, but that's not real learning, because they're not using all their senses to interact with the information that is coming. So that's why even though they can sing that song, they cannot really interpret the concept most times when the child has a language delay. They can't interpret the concept because they're just consuming unidirectional. Also, the screen is very hyper stimulating for the brain. Most of the devices we have nowadays, the screen, the tablets, phones, laptops, they stimulate the dopamine center of the brain, which is the same thing that cocaine does. So that's why we call screen digital cocaine. And that's why you see a lot of children get addicted to screen. When they take the screen away, the child is crying, the child is shaking, the child is just seeing the way cocaine addicts do when they are seeking that thing. So although screen gives the child this high feeling, but that high feeling is dopamine, is activating the dopamine center. And the people that produce most of this content, especially most of these kids program, they intentionally do it because they want it to be addictive. So you see those things are flashing lights, they're singing, the colors, everything is like so fast. So when you take away the screen, the child is seeking that high because that dopamine feeling is not there. So that's why the child is shaking, the child is crying, the child is, all those things are happening to the child. Of course, when the child is in front of the screen, the child is calm. Like a cocaine addict, when he takes the cocaine, he's calm. But when they start seeking, so the child is seeking that high. That's why the child is crying. So what this does is that when the child is just in front of the screen, because it's unidirectional, the child cannot interact with it. The child cannot use their senses. So it's like it shuts down all the other ability. Do you understand? Because the way language is designed to be developed is to interact with your environment, interact with people physically, things physically. You can't just be watching a screen and say, look at the red board, they put it in the red board. You can't really interact, you're just consuming. So the left side and right side of the brain, they don't particularly develop to their maximum at the same time. In like the first 2-3 years of life is the right side of the brain that comes up and is well developed, and that is the social emotional part of the brain. So that's when that's why the way they talk about play for young children, that's why play is important, because it's building and enhancing that right side of the brain. And that's where even the social use and of language and communication comes into play. So when you put the side on the screen, that right side of the brain is not developed, is not enhanced. Screen is more of a left brain kind of, it's like you're activating the left brain too early for that child. So screen, the right side of the brain is shut down, where the child is supposed to be developing social communication, even emotional and behavioral. That's why children that watch screen a lot tend to have a lot of behavioral issues, because they're not building their emotional behavioral skills. That is the right brain thing. That's what's happening. So by the time That time now passes. The child has not built it, because remember, children don't just outgrow things, they build skills. So if you don't build it, when they get to the age that they need those skills, they need to start talking, they need to start interacting. It's not there because they didn't build it. So screen is just consumption. It activates the dopamine center. So the other part of the brain that's supposed to be building, they are not being built. All the child is doing is consuming. So that's why you will notice that for some children, when the screen is that's taken away, not just taking away the screen, now incorporating intentional social interaction with the child, because that's how God designed that they learn. The children now start learning, start acquiring language, because that is the normal way. They're now using their senses to interact with their environment, interact with people, and they are now building language. When it comes to the issue of bilingual, even in the professional world, I mean, some people still argue with it. I won't tell you that we 100% agree, but personally, I don't believe that speaking more than one language causes speech or language delay affect. And I'll explain why. Because most of the children, if you notice, the issue is not the words. The issue is like the comprehension and functional use of language. So if the language is the issue, the highest that will happen is that the child will mix tenses up. Not that the child will not be able to communicate. If I go to France, for example, I can't speak French. So I have an issue using the words, but I will still be able to communicate. Yes, I will make maybe the French instead of saying I want to eat. Maybe I will just say I'll use the word of shoe inside. I'll use shoe, but I'll be able to describe what and communicate what I want to say. They will now correct me that no, that word is not the word. This is the word for. And I say okay. But if you notice, most of the children, that is not the confusion of tenses. That's not the issue. The issue is functionally using the words that they have to communicate, or ability to understand and comprehend. So personally, I don't believe that bilingualism causes speech delay in a child. I don't, because most of the time, if you look at the issue, it's not just speech delay, it's a language issue, it's a communication issue. So if the language is the issue, higher the child will confuse cup for shoe, but the child will still be able to communicate. Or by the time you're trying to redirect, the child will be pointing and saying, no, is this what I will not say, okay, come, that's okay, no, this is not cup, this is shoe. The child will not get it. Next time the child will use it correctly. So that's why I don't agree that bilingualism, causes speech delay, or that's
Okay.
the issue. I
Dr.
believe most
Lola,
like the other issue.
Dr. Lola,
Yeah.
we have to stop there. You have to remember that we are parents. Our time is very precious. So just
Oh my
give
God.
me a minute to let's just take that in. That's the thing about you professionals. You can talk forever. So sorry that I
Can you
have
just give
to.
me 2 minutes? Let me
No,
just
no,
write.
just hold on, because I don't want us to miss. You're about to go into something else. So I feel at this point, let's just hold on 1 minute. Does
Okay.
anybody have any question? I just want it to be interactive and I'm mindful of time. Does anybody have any question or have any response to everything Dr. Lola has said before she starts to go again? Thank you so much for everything you have shared. You are doing a fantastic job. But I really want some parents to comment about this because
Okay.
does anyone, you can drop it in the chat, I'll read it out. I have something to say. That's why I didn't want you to go beyond the screen matter. um
Okay.
Two things. One is the milestone charts, because I'm mindful that a lot of parents, me myself, I don't like this concept about milestones. It really really gives
Yeah, of
us
course.
anxiety. So I think you need to balance it out in terms of, I understand that there has to be a standard, a global recognized, but we are parents that we already recognize that our children are behind. So what do we I want us to start talking about practicality and strategies. So now we have a parent that recognizes that their child is not meeting the milestone for speaking. Since this is what we are talking about, what can we begin to do to help that child? Can we start with that? Then we now move into the screen part, please.
No, some of those things, I still going to talk about it.
No, I just
That in
want
my
us. I need us to change the energy of the
oh
presentation.
my God.
If you can just do
So
that,
that's
just
why I said that. When I talked about, before I talked about
mm,
the chat, I said I don't particularly like those chat.
mm,
It's just for like just a standardized.
mm,
I mentioned it that children develop differently, and don't get stuck
mm,
in saying, oh, my child isn't. That's what I was saying. That don't get stuck. Look at the progression of how the development goes. Just like saying neck
mm.
control, then sitting, then crawling. So don't get stuck and saying that, oh, my child has not attained neck control at 3 months. I mentioned it
Okay.
that this is just a child, but don't get stuck in saying so at 6 months, if your child is not talking at this, then you not get no. But you need to understand how the progression happen so that if your child is 2, you don't just go to the milestone at 2. We need to check where the child is so that when they are doing intervention, because intervention also will follow the progression regardless of the age. Do you understand what I'm
Okay,
saying?
I
I
understand it
mentioned
because
that.
yeah, you did, and you also mentioned the fact that because some of the challenges that some of us, if I can speak for some of us, while people are gathering their questions, and I allow you to come back and finish your presentation, is when you speak to, there's a lot of challenges with as with getting the care, the strategies, the intervention, it's very expensive, not everybody that can pay for it, so what, and you are almost in a situation where the professional is telling you to go and come, because many of us have found ourselves in that situation. So what can we as parents begin to do while those professionals are
Let me
telling
tell
us to
you,
go and come?
all these things are in my slides. Just like
Okay,
I just
so
dropped
let's
it.
go
All in
into
my slides.
that, let's go into
Okay,
that
let's just go
practical
into
part.
that.
Yes, please.
Okay, let's just go into that. All those things are in my slides. Okay, maybe I like that. I said that 20 minutes is really really small. Okay, let me just move then. Can you see my screen?
The screen is still up. It's saying causes of speed
Oh, my
delay.
screen is up.
No, it's still there. It's saying
Okay.
causes of
Oh, I
speed
didn't
delay.
know. Okay, I think
But I really want us to
okay,
start
yes.
talking about
So let's talk about the
practical stuff.
cycle of speech development. Okay, there are different external things because sometimes having those backgrounds, like some of the questions you sent to me, or is it autism and speech delay? Is it the same thing? So some of those background things, I will just go through. I will not go through them, but they are important to layer it because when it comes to intervention, like I said, you don't just start with the diagnosis. We trace, okay, where is the issue? When the child goes for assessment, they are trying to look for even though they may not use the language chart strictly, but they're still going to look for according to the progression, where is this child? Because the intervention has to be tailored. We have to meet the child where the child is, then begin to support the child ongoing. So even though they will not focus on the age per that milestone, but they need to identify the milestone level because the intervention has to be tailored to the child's ability. So how do you support a child? I talked about focusing on functional communication. Then number two, building a bridge. So when it comes to communication now, communication. So it's like when you have a bridge, you know what a bridge does? A bridge connects one part to the other part. And that's what I was talking about during my conference, building bridges. So when it comes to communication, when it comes to language, the first thing is we want to build communication before we start building words. Don't just say, okay, I want the child to talk. No, we will get the child there, but can we build a bridge for communication? What are some of the ways we build bridges? Things looking for ways to help the child communicate. So we start from we need to know the language level of the child. First of all, we need to so if a child is using one word syllable or two word syllables, any intervention you are going to do, we're not just going to jump to trying to use sentences to communicate with that child because it may be too much for the child. So you build a bridge looking for ways to help the child communicate. What are some of the ways? Things like sign language. And that doesn't mean that sign language is going to keep the child stuck there. We're not going to get the child to build language. No. Even when it comes to AAC, some children use AAC. I don't have a problem with AAC. It's a bridge. But there should be tools that we're using for the child to communicate while we now build language. So we use what do you call it? We can use pictures. We can also use pictures. I'm sure most of us know about PECS, Picture Exchange Communication System. So these are like bridges to help the child communicate, identify things. And when they bring those things or we use those things, we add language to it. So when it comes to developmental delay, it's like, let me say speech delay is one of developmental delay. The child, we need to support so things that other people can learn easily. These children need extra support to be able to build those skills to learn it. Okay, so some children may be able to identify bottle. Okay, the child want their wants and needs, their bottle they want to eat, and they have challenges using words. So can we build a bridge to help with communication? Because most of the time behavior issues arise when a child struggles to communicate, which is understandable. Even adults who have hearing challenges, you notice sometimes they're trying to communicate with you and you're not getting across. They often get aggressive because when you cannot communicate or express yourself, you get agitated and things like that. So we want to bring down behavior so that the child can be more present to be able to learn. So when you're trying to label things, you're trying to use words to help to give the child the words to express themselves. That helps. So How do we build bridges? We bring tools. So you can use sign language. Even when it comes to sign language, I tell people it doesn't have to be the classical sign language. What it just means is that the common things that the child often, wants or needs interaction, you can create an easy sign language. Some of those original sign language maybe more difficult, the sign for certain things. You can create your own sign, which maybe everybody in the house will know that maybe this is eating, or this is I want to poo or something, to be able to help the child. So when the child is trying to express themselves, most times as mothers, you know what your child wants. Most times he wants something you already know. Instead of just giving it to him, you can attach that sign to that thing and you do it. Or if you have pictures, picture exchange communication system, PEX, it doesn't have to be any big deal. You can have flashcards that identify those things. You can also, if you go the extra mile, you can take pictures of their common things in the house. Or if they are, you can get pictures, laminated pictures or pictures of those things that just identify that thing. So when the child wants that thing, you are teaching them to be able to label it, then you put words to it. Also, practical things that I also share to support children is you use the daily interactions of the day to be able to help the child to build language. How do I mean? We don't learn language in isolation. So it's not as if, no, even when you go for therapy, you are learning speech or they are learning intervention for the speech room. No, we learn language to be able to use it in everyday life. That's the essence. So what are the opportunities in the day of interaction with your child that you can use to help and support them to build language? Oftentimes there are some activities in the day that like constant: bath time, feeding time, sleep time, dressing time. At least they will happen at least once or even more than once in a day. These are opportunities of interaction to be able to build language. Because remember, we don't learn language in isolation. We learn language so that we are able to use it in every day. So that's why you can't just sit down and see the chat and say cat, say math. Because are they using cat in everyday interaction? Are they using math in everyday interaction? No. We have to start with building language for everyday interaction. So what are everyday activities that we are engaging on a daily basis at home? So those activities, you put a structure to it. Start putting a structure to it as you interact with the child with those activities. Then we put language to that interaction. For example, I give a practical example: bath time, for example. So what I tell people is create a routine, because it's very important. Routine. And because most children will struggle with transitions, okay? So, and unpredictability also is not really good for children, especially children that have developmental issues or speech delay. So create a routine. So your morning routine, your night routine, your day routine. You can start with one, even if it's night routine. Yes, I know we may work, we may have other things, but as much as possible, create a predictable routine. So maybe bedtime is 9 o'clock or maybe 8 o'clock, whatever your time is. At least 1 hour before that time, have a structured routine and begin to communicate with that child. So don't just say 9 o'clock, oh, let's go and bath like that. No, 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 no. Let the child know. See, when a child, even if a child has speech delay, remember that I said expression may not necessarily be a picture of comprehension. So one thing is that don't often deal with your child just with their expression, because most times the child may understand more than they can express. Why am I saying that? In explaining things to them, what you're going to do, what you're doing, sometimes you think, but he won't understand it. No, most times the children will understand it. Also with consistency, they will be able to understand it. Do you understand? Oh, you're raising your hand.
Yes, because that's where we need to stop now. We have to
My
go
God.
straight into our Q&A now. Like I
Okay,
like that.
okay.
I like this slide. No, go back to that other slide.
This one.
Yeah, leave this slide on while we go into the
Okay.
Q&A. Doctor, I know you're very passionate. I already knew that it was going to be difficult to keep you to talk for 30 minutes. So I must
Really.
apologize for breaking into your train of thoughts, but I really want this to be a very practical and engaging session. So I'm going to bring Mrs. Felicia into, so if you can just unmute um Mrs. Felicia, because I really want to hear from you as well in the context of, Dr. Lola has said the background. She has given us a lot of information as to what speech is, what language is, what communication is, and the services that you offer as a speech and language therapist is one of the interventions that she talked about. So I want to give you the opportunity to share your experience. Are you with me, Miss Felicia? Can you hear me? I want to give you the opportunity. You're on mute. I want to give you the opportunity to answer a few questions. So let me know when you are ready because I really want to have your own context as well as someone who works as a speech and language therapist in Nigeria. So what when a parent comes to you with a speech and language concern that their child is not speaking, what will you normally do to support that parent or that child? Just give us a typical example of some of the things you do. You are still on mute. You are still on mute.
Maybe you can unmute her from your end.
It's not allowing me to. We cannot hear you. There's a microphone button. Okay, I will allow her join. I will allow her rejoin back. Okay, one of the question, maybe I will come back to her. So one of the question I wanted to ask you, Dr. Lola, has to do with because you spoke passionately against screen. So I want you to share as a technology enthusiast, how does that now sit in the context of AAC, like you mentioned? So what would families that have been encouraged to use AAC, what will you advise if you are saying that screen is not
No,
is
screen.
unidirectional?
See, AAC is different
Okay.
because the concept of AAC is just like even when it comes to some speech apps like Gemini. Some of us might have heard about Gemini. Some of those, like I said, when a child is watching screen now, watching cartoons and all that thing, is different from AAC. Number one, the way those devices are designed, they are not designed with the same hyper stimulating technology. Also, the child is not sitting down with AAC to consume.
Mm.
AAC is like PECs, PECs like a
Mm-hmm.
picture. The child is not communicating with that picture. It's different from a child is sitting in front of a screen.
Mm.
However, there are certain situations that screen is often used in some therapy situations, especially when children have maybe some what do you call it, mobility, and they're trying to get the child to concentrate at the beginning of the therapy. They can bring in screen a bit for the child to come and to get the child's attention. But often you will notice that it's not like it's a consistent exposure. It's different. Do you understand? So when I'm talking about screen in that context, I'm talking about putting a child in front of a screen to just sit down and be consuming. It's different from AAC. No.
Okay, I
Even
got
though,
it.
yes, AAC is like a tablet, but no. Those are specifically designed for communication, not for consumption.
Okay,
Communication and interaction. Do you understand?
I
Also,
get
let
it.
me say this: if a child is used to screen, I'm not now saying just yank off the screen. No, you have to wean the child off. Sorry, this thing is not giving opportunity to begin to explain those things.
We
You're not
don't
just
have
going to say, oh,
time.
don't watch screen again. No, no, no,
Yeah,
no.
that's
Begin to
fine.
replace with more
Mm.
interactive things. You understand? And everything a
Okay,
child can learn off the screen. Let them learn off the screen, not
okay,
on the screen. So it's not a
perfect.
yank it off thing. No, 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 no. It's a practical thing of win off, replace. So
Okay,
don't let the screen be the one to be doing the
we
interaction.
got you.
Replace with functional interaction. Yeah.
Dr. Lola, thank you. Sophia, you have your hands up. Can you ask your question? I'll come back to you, Miss Felicia. Just stay there.
Okay.
Go on,
All right.
Sophia.
Hi, Lola. This is Ufoma
Yeah.
but we're in the same set, the same house
I know, and I did just together.
at Asia House. Good to see you again after so many years. Okay, just a
I
quick one
agree.
because you kind of touched on my question now at the
Yeah.
end. I was going to say in a situation whereby, your child, like for instance, my son is a visual learner and because he was
Mhm.
exposed to screen and he learns I noticed that he knows so much because he learns from the screen. That there are lots of things that I didn't teach him, but he's communicating those things that he learns from the screen. How do you now balance this out? Like, he has already become that kind of learner where, He has to see something. Once he sees something and he watches it, he just grabs it. Right. So do I completely eliminate the screen? Like, how do I balance it out? Because I see that he gains so much, keywords. He knows a lot of things that I didn't even know that he knew from the screen. So what's the balance there?
Yeah, that's what I was saying. That the balance is screen should not be, even though a child is a visual learner, they can still learn with other visual things. Do you understand? Charts, books, some other things that are colorful, and all those kinds of things. The point is that because we have to balance, something has plus, but it also has some negatives. Do you understand? So that's where I'm coming from. Don't just say, okay, he's learning everything on the screen, but is the what of the about the negative impacts of the screen? We need to balance that. So if a child is already used to it, I said, it's like a detox. It's like replacing. There are certain things. Okay, he likes to read or likes to watch things. Can you replace with other kinds of books that have a lot of all these documentary books, even encyclopedia, all those things that have all those picture things? Can we begin to replace and balance it? Also, you can have a screen plan, you can have a media plan. So your media plan just says the amount of screen that is allowed per day. So there's a screen time. So you are regulating it. Not just, some parents in the morning just put the child. No, have a plan. But discuss your plan with your son. That's what I always say. Don't just, according to whatever his level is, tell him we're going to do this, and negotiate with him, especially depending on how maybe understanding or how he can respond. Create a plan. It can be, if you are doing 5 hours a day, don't just start no screen. Maybe you start with 2 hours a day and have a time. So 3 to 4 is our screen time. Then now be intentional with the content you want him to learn per time. And any content you feel you can replace out of the screen, then take it out and only put the necessary content. So it's about like weaning him off. Be practical and have a plan and discuss with your son, or whoever is in your household, whatever operates in your household. Don't just yank it off and say no. Then whatever content they can do out of the screen, replace it with more interactive activity, even though he's learning. But we can't negate that there are downsides of the screen. And can he begin to build other skills and other interests out of the screen?
Perfect. I like that balance. See, we must always give a balanced view when we are talking to parents. Okay, Blessing, you can ask your question. Thank you, Dr. Lola, for answering.
Thank you, Dr. Lola. Thank you, Emmy. This has been really informative. So I wanted to ask, for a child who can speak, can communicate, but only when he's around the people he's familiar with, within his comfort zone. But when he steps outside or sees a stranger or in a crowded environment, the child is mute. Are there any practical strategies we can use to support that child to begin to speak outside his comfort zone? Thank you.
Okay. So one of the things you should also do, first of all, is that you mentioned crowded environment. I'm sorry, excuse me. You mentioned crowded environment. Does it have hypersensitivity to sound? And sometimes parents may not know, because some children, when they're in like a crowded environment, they may have what we call auditory hypersensitivity, sensory overwhelm. In that sense, you may know, you may not know, but we have to put that in mind. Also, practical things you can do is that, can we begin to look for like recreational activities, interests, like maybe sign them up for interactive sports, some things. So what are the things he likes? What are the interests? And when I say that, don't just say he doesn't like this. No. Have we exposed him to different interests? So things like sports, can we look for, but sports, let it be interactive sports, not things like athletics. Not athletics is just you running, but sports that encourage turn taking, because communication and language is turn taking. So we need to look for things that encourage turn taking. Also, when you find something you like, it can be very motivating for you to want to engage. So things like a form of sports, in form of recreation, maybe is it art class? I'm just giving an example. I don't know what of things in your area. Art class, Lego club, all these robotics things that they do. Also, in most, I don't know where you reside, but if you reside in diaspora, most suburbs during the holiday, their libraries always have this activity, all this Lego club, kids, whatever that they do. So look for interest. Expose him to different. Don't just say he doesn't have. No, have you exposed him? So if he has that kind of thing, but he's a boy, I would have said maybe girl dance, because I don't think boys really do dance anyway. Dance, even things like self-defense, karate. And I always tell people, self-defense and karate is not about fighting. If you really get the people that do it correctly, but I'm not saying you have to, they do it to build what do you call it, following instruction, confidence, and all those things. That's the real essence of those things. So if you can have those kind of places, you may be able to build friends that they have common interests together. So it can be motivating. So when you now do that, you can now be intentional. So you too, as a parent, you will step out of your comfort zone in those places. You want to make friends with so if you see that he's gravitating towards one child, another practical thing you can do is that when your child goes to places that are children, they can wear shirts that have things that children like. When you see it's just like it. So other people will want to gravitate towards them. Do you understand what I'm saying? So things that encourage those kinds of activity. So look for recreational activities, sports, Lego club, all those kind of things, and expose him to it. If he now has interest, you can now begin to go to those places and intentionally try to make friends. And that kind of thing, I don't encourage drop-offs. I encourage things that will allow parents to be there so that you two can intentionally, because if you are making friends with people's moms, children will be looking at you that you and this person's mom, they can find easy things. So you don't even need so many people. Start with one or two. Those one or two can become the pair partners that you can now intentionally build relationship with. You come every week, they see them, they start seeing the same people, build friendship, but you can take the friendships out of those places as well. Then I don't know how old your son is and the school he goes to, what kind of activities they have. If they have sports day or whatever, or all those kind of things, you can go and volunteer as a parent there. And if your son is doing that, you're chaperoning, those kind of things. So really, may not need many people, but we need one or two people, friends, that he can build a relationship with, and you can use them as peer partners to help with his interaction. And once you find those one or two people, go the extra mile as a parent, to be nice, buy things for them, wear nice shirts, those kind of things. Those children, they will like you, it's just intentional. It doesn't have to come to your house. Even they play in the park, wear nice shirts. If you buy one for your son, buy one for the boy. I think those kind of things. The reason is you want pair partners that you can use as tools to be able to build skills. I hope that
Perfect. I
that's
think
it.
she has responded, thank you, and she also confirmed that he doesn't like loud music. Okay, in the
Because we'll
next
be
few
dealing with an
minutes,
auditory. We don't have time for that, but yeah, there's
yeah.
something I want to talk about. That auditory thing is a big deal for a lot of children. I
No,
know
she
both
has
parents
already
don't
said
know.
he doesn't have
Okay, he
like
doesn't have.
he
Oh, he
listens
doesn't
to
have
loud
auditory. Okay,
music, so it's not about oversensitivity to loud noise. Okay, we'll wrap up the next few minutes. Please bear with us. We have a very passionate speaker here. You can see I'm trying my best to keep her on on task. But I would like Madam Felicia, Mrs. Felicia, to say something. So I was asking you a question. You can hear me now, right?
Yes, I can hear
Yeah,
you.
because I really want to have your own context because you live
Okay.
in Nigeria. So when a parent comes to you and it tells you a concern that their child is not speaking, we can start with a scenario with a young child, then we can move into an older child. So what are the things that you will normally do to support either both the parent and the child?
Okay. I want to thank you so much for this platform, and I'm sorry for that disrupt. I'm so sorry. So, if the first thing I do with the parents, I always tell them after they go assess the child. If they say no, we'll do assessments. So the assessment comes first, and I agree with what the first speaker. She has spoken a lot. So you do assessments with them, then because the base, we call it baseline. You have to know the level where the child is. So you cannot just jump into the life of the child just like that. You have to know where the level where he is or her is before you can move into next stage. So we encourage the parents to train, because if you don't train, whatever the speech therapy is doing with the child, you may not be familiar with it. So we do also encourage them to do a training like what we are doing today. So with that, they will be able to help the child at home also after the speech therapy has finished the job with the child. So, and also we engage the child based on the baseline, what the child can do to regain he or her speech. So for what I do here with my experience, what I usually do, I do pray, because we already know that we have a delay, we have a challenge. Because most parents, they are so anxious, they sometimes they are frustrated. So in that your mood, it's only God that can calm you down, and also give you a hope that there is a hope. There is not really, it's not that bad. It's not a situation that you cannot gain solution. So we also introduce prayers with any given task. We introduce prayers, because prayer is a solution, and it's God that knows how to undo them, and it's God that knows how to, even with all the activities. Remember, when you go to the hospital, the doctor will tell you that yes, we cure, but it's God. We do all our practical experience, but it's God that cure, is the ultimate healer. So we always ask them to put that one as number one in prayer. And again, be patient, because many people, they are not patient. That is why they have a lot of challenges in schools. Even when you see some parents, they rotate the child will go to one school this term, next term they will change the child, because they find it difficult to handle the children. So you have to build that the spirit of patience, how to work with them, because these children, they sometimes they feel that they are in different world, because they want to communicate with some people that will understand them. So when they do not find that person that is patient with them, sometimes you see bullying. Some parents will be, you will see they even bully them in school, because many people tag them that because they have delay, they don't know how to express themselves. So they people bully them. Even when a therapy is bullying a child, that means the people around the child, they will also bully the child. And because they don't know how to express themselves, the parents will not even know what to do. So in that aspect, when there is no improvement, parents will now be finding a way to like move the child from one place to another. So we also encourage that you should educate the family. The family needs to, because he can't stay with the mother all the time, or the parents always. We have people around the child that need to be educated. That is why you need to take them to the place where they can understand them. Are we following? Am I answering
Yes,
the
well, yeah, you are answering. Let me just to say, um, just to add something, just so that I really wanted to. I like what you are doing, and which is really why I love your strategy of the way you support, because you really do empower the parents and the family, to be able to support the child at home, which is very,
yes,
very important. But
yes.
for the context of what we are talking about,
Mm.
how would you say, because I always like to bring a balance view from other countries, so that parents like us will also see how things are happening in other regions. Would you say
Okay.
that things are improving in Nigeria for families that are raising children with, speed delay, regardless of the diagnosis? How is it? How will you rate the experience right now in terms of the knowledge availability in Nigeria right now for families?
Okay. I can rate them like 80%, because in school now there is no more. They have embraced, like um they have embraced therapies, and accept the fact that there's a need, for these children to be treated and to be accepted. So in Nigeria now, they have accepted it, and there's a lot of improvement towards that aspect. So in schools, they accepted. There's no stigma anymore. So unlike before, so I would say like 80% improvement on that acceptance, accepting them in a community.
That is very encouraging to hear. Thank you so much. I'm happy that we were
You're
able to
welcome.
fit you in. We don't have that much time, so we'll go to.
Okay.
I don't see any question in the chat, so I want to assume that everybody has been able to, follow and have gotten their questions answered. So, what last words will you give us? Dr. Lola, can you stop sharing your screen? Sorry, just so that we can capture your face properly. So, in terms of most of us are parents here. What last words will you tell us? Can you share with us, or advice will you give us for this interesting parent journey that we are all on?
Okay. Okay. Before I go, I just remembered something. The time is so short to say a lot of things. For parents who your child is very screen oriented, because some children have what we call a hyperlexia. They can learn a lot and a lot of things. So that are very maybe mathematical, they're very smart, so to speak. So one of the things you can also do is that let screen time be more skill building. How do I mean? You can introduce things like typing. Let them learn PowerPoint. Let them learn. You'll be surprised that they can learn those things instead of just consumption. So you have to understand the concept is not consumption. They can begin to learn STEM, robotics, and all those things. So channel it in that light. It just like might take some extra time from you. Then one last thing I would like to say, I say that to all my clients, understanding the concept of therapy and treatment. There's a difference. And that's what Ms. Felicia was saying. Any therapy that does not involve the parent or the family is not effective. And we know therapy is expensive. So there is no way, even in advanced countries, that are going to pay for so many hours. So we close the gap by the parents doing things at home. So enriching the home environment with the resources, the toys, the books, and all those, and play, these things that we enrich with, so the children can begin to have an enriching environment. Also, if you can, creating time for let play time, create some interaction, maybe even it's 30 minutes, 1 hour, like your connection time with your child every day. Let it be rich with enriching activities. Then talk. So anything you are doing, be describing it. Final what I want you to say is that one of the scriptures that I have is Isaiah 31:15-17. That's my anchor scripture. Lamentation was heard in Ramah, later for our children, for they were not. But thus says the Lord, refrain your voice from weeping and from eyes from tears, that all your works, all your labor, effort shall be rewarded. Your children will be brought back to their border of destiny, and there is hope in their end. So I want to encourage you. You need patience, you need love, and see, your environment. I would always say your environment doesn't have to necessarily be the family, that is people that your environment are people that share your value and accept and love your children. Even the professionals that you work with, I tell my clients, any professional is speaking negative about your child, I don't get how good they are run, because words are spirits and they cast on your children. So I tell my parents, interact with your children with who you believe God has called them to be. So when you see your son, talk to your son, I believe in you, I know you can do it. Don't talk to them like you see them. Let me share one testimony. There's a woman, she's in Nigeria. She had 3 children that were in the spectrum, they couldn't speak. They are like teenagers and they are fine. And she asked her son one day, when you couldn't speak, what was going through your mind? The boy said something profound I've never forgot. The boy said, Mommy, you believed in me. You interacted with me like you challenged me, and I wanted to live up to the expectation. There's a lot in our children that is hidden. Your children are counting on us, and God is counting on us. So when you look at your child, don't interact with them with the level they are. Interact with them in who you believe they, and tell them to their face, I believe in you. Because everything you say to your children, they're absorbing it. They know more than you think. They have more ability, and it's shaping, their spirit is perfect. You understand? Everything we're talking about is just the mind. The spirit is perfect. The spirit is so keep speaking to them and believe it. There's hope. It will work. If you're going to do any therapy, speak. This thing will work. You're spending money. This thing you must work. Don't say it's either it works or it works. There is either your child will fulfill their destiny, or they will fulfill that destiny. So I want to challenge you. I don't know, when it comes to prayer, I have a lot of scriptures, but this is not a faith based. I didn't
Yeah,
come
it's
with
not a
that, but
face. You
I have
see,
so many
I
things on
I
that.
already knew this scripture thing was going. When you bring two women that are women of God, even when you say something is not faith based, it doesn't enter their head. They will still come. So please just help us drop the scripture. One of the one you used to share. Just drop it in the chat. One of our parents is very interested. Madam Felicia, I have so much respect for you. You know that. In fact,
Thank
maybe I need
you.
to give a separate session for you, just for you to come and maybe we'll do a scripture based one. But I'm mindful that some of our audiences are not Christian. So can you give us final words
Okay.
on what advice will you give to parents? I'm really sorry for taking so much time. We'll stop at 7:15. So just give us advice. What advice will you give
Okay.
to us parents?
Okay, ma. Thank you so much for this opportunity. I want to advise our parents the way my first speaker has spoken. We should always be positive. To keep believing in them. These children, they know a lot. Like a child I'm working with presently, the child now, a child that cannot speak. I remember he cannot speak for like 10 good years. But when he pick up, if you hear the grammar, that child is blowing. Yeah, it blows my mind. I say, is this child? Each time I'm speaking with him, I'll say, is this you? I'll just giving glory to God. I say, if God can do this, that means there's no any child on earth that cannot speak. So you just give them time. Just be patient. It's like when you are investing into a project. It take process for that thing to come up. So just relax. No matter the amount or the time, or you feel that the stigmatization or whatever that is going on, just calm down and believe God and keep speaking that word. Keep what she just said. Just keep believing that child, that one day that child will still be speaking, or even speak more than you. Yes, they can speak more than, once they catch up, they can speak. Even when you don't, you sometimes you want to shut them down. Because they have that delayed, they will speak. That you'll be thanking God. That will be every parent's will, or it will come to pass
Amen. Thank you.
shortly.
Thank you.
Yes, ma'am.
Thank you so much. I mean, I don't know what other advice. I mean, we have it. We have it. It's been said. Patience, belief. I believe
Yes.
so much in positive affirmations. I want to
Yes.
thank everybody. Sorry that we went over time. Blame Dr. Lola. Thank you so much for joining us. I'm sure a lot was shared. Dr. Lola, will you share your slides with us? Will you
That's
be able
fine.
to share your slides? No, yes, we'll talk
No,
about it
that's fine.
later. I want to thank everybody for coming. Dr. Lola is very active on social media. You can contact me if you need, if you want, if you don't have her contact. And if for those that are based in Nigeria, if you want to speak to Madam Felicia, I can also share her email address. Though they've talked a lot about faith and prayer, the work they are doing is action. So the faith and the prayer must also be accompanied by action. So if you need that action part of them as well, please. Thank you so much for joining. Thank you for joining us, and see you next time.
All right.
Bye bye,
Thank
everybody.
you.
Thank you for watching. Follow us on all available social media channels.